let's say somebody wakes up with a cough and they go to the doctor because it's not going away after a week. He does a chest x-ray, finds a lung mass, they biopsy it, and finds out the person has lung cancer. You know, that lung cancer didn't start the day the person developed the cough. It very often started decades before. Some carcinogens are activated within the body. They can damage the DNA. They can also turn on certain tumor promoter genes. So even if they don't damage the DNA, they turn on genes that will promote cancer. And it can be decades before a clinical cancer will show up. At any of these stages, there are phytonutrients and certain medications that you can use to interrupt that. And one of the things that I think oncologists have really missed the boat on so far is the fact that everybody, you know, of all the 7 billion people in the world, everybody's walking around by the time they're 20 with cancer in their body. Now we know that from autopsy studies where people in their 20s died in car accidents or wars. They do autopsies, they'll find occult or dormant thyroid cancer, breast cancer, stomach cancer, colon cancer in almost everybody. Many people have more than one dormant cancer. So, you know, we're the most rapidly evolving species on the planet. Our DNA is becoming mutated. We're exposed to environmental chemicals over the last several decades that our ancestors were never exposed to. And so the whole point about the fact that everybody has dormant cancer really changes what the philosophy is. It's not to try and eradicate every last cancer cell in the body in a given patient. It's not possible. You're not going to make one person unlike the other 7 billion on the planet. The goal for you, for wellness, is to keep any cancer cell in your body that's dormant, keep it dormant, not so that it doesn't become active. And if you've had an active cancer, you want to make it to where it becomes dormant and keep it there.